Welcome back everyone. Today I'm going to show you some hip mobilization exercises to help give you some pain relief in the hip, especially if you've got some hip impingement or if you had an injury in the past that could be causing a little bit of spasming or just a bit of pain in the hip joint. A lot of times we spend so much time stretching the muscles around the hip or even strengthening the muscles around the hip, for example, the glutes or the hip flexors, we forget that the joint is actually made up of fibrous tissue as well that is connected from the hip bone to the femur bone. So mobilizing this joint and allowing these tendons and ligaments to move in these new ranges of motion is very important to promote movement in that joint and also prevent degenerative change, for example, osteoarthritis or even pain that could be impinging in that joint and radiating pain somewhere else. I hope these mobilization techniques help you as much as they help me and my patients.
90-90 internal rotations. Sit on the ground with your hands behind you to support yourself. Have your legs bent to roughly 90 degrees and your feet slightly wider than your shoulders. Now that you're in a comfortable and stable position, slowly drop one knee towards the floor as far as you can, while keeping the opposite shin vertical to the ground as much as possible. Repeat this on each leg, holding each position for about 3 seconds before you alternate to the other leg. As you can see, my knees do slightly move away from the other knee that I'm trying to move towards the center. This is my end of range of motion, and there is a slight pinching feeling with the knee that I'm trying to bring in towards the center, which is internal rotation. Do this 10 to 15 repetitions on each leg and repeat the sequence 3 to 4 times. Internal rotation mobility is rarely practiced. We tend to do a lot more external hip rotation instead, where the knee is promoted to move outwards, such as the banded glute exercises. However, if you want to have full control of hip movements, especially under load, it's important to do exercises like these. They promote muscular control, mobility, especially in different ranges of motions. And this will prevent a lot of injuries in our daily tasks and obviously our preferred sports as well. I do this for my preferred sport, Olympic weightlifting. 90-90 hip shifts. Sit on the ground with your hands behind you to support yourself. Drop both legs towards one side while simultaneously shifting your weight towards one side of your hips. Your knees should end up pointing into the same direction. For each rep, allow yourself to feel and appreciate the stretch within the hip capsule of the hip joint for about 3 seconds. Then slowly and in a controlled manner, repeat the movement onto the other leg. Do this for 10 to 15 repetitions on each leg and repeat the sequence 3 to 4 times. The more you're leaning backwards, the more easier the exercise will be. Try to stay upright as much as possible, but obviously this will make it a lot more harder for yourself and therefore accentuate the stretch within the hip capsule. A research paper was released in 2013 by Stuart McGill, titled "Improvements in hip flexibility do not transfer to mobility in functional movement patterns." The results showed that improvements in passive range of motion and core endurance do not automatically improve functional movement patterns. Meaning, just because you have improvements in passive range of motion, meaning flexibility or core endurance, doesn't mean that you automatically have better functional movements. So functional movements could be like squatting or moving in daily tasks, or even the sport of choice, which implies training and rehab programs may benefit with additional focusing on, in quotation, grooving new motor patterns in newfound range of motions. This is why it's so important that once we stretch and increase our mobility, we must solidify this new range of motion into our movement patterns with intentional exercises and movements. Some people might even call this muscle memory. 90-90 hip rotations. Sit on the ground and drop both legs towards one side and shift your weight towards that leg in front of you, or simply just lean over that leg. If you're finding it difficult to hold this position, just grasp the shin in front of you to anchor your body down. However, do not use excessive strength to create a stretch, but use your weight instead in a relaxed manner. This will mainly stretch the glutes and the piriformis muscle that could be causing pain from the hips and referring pain down into your legs. But it also promotes internal rotation in the rear leg and external rotation with the leg in front of you. Hold each one of these positions for about 3 long seconds and then alternate on each leg and repeat the process. Do this for 10 to 15 repetitions on each leg, and then repeat the whole sequence again 3 to 4 times. So 3 to 4 sets. This is a bit like the pigeon pose in my previous videos on my YouTube channel. If you're interested in more hip mobility exercises or stretches, definitely check them out. 90-90 internal rotation. Sit on the ground and drop both legs towards one side. Now turn your body towards that rear leg, where the leg is internally rotated and your knee is flat on the ground. This will accentuate and promote the mobilization of the hip capsule in the rear leg and promote internal rotation. Hold each position for about 3 seconds and do about 10 to 15 repetitions on both sides for about 3 to 4 sets. I found this technique to be the most effective to improve my internal hip rotation. It loosened up my hip and reduced the pinching and tightness pain inside my hip. If you want more of a stretch, try holding this position for about 30 seconds instead. It will be much easier for you to hold this position if you grasp your shin in front of you. Make sure with all these stretches that we do in this video, you're doing them in a relaxed and controlled manner. And make sure your breathing is long and controlled as well. Try not to use too much strength or tense up when you're trying to push yourself towards the stretch. Sometimes when I first did this stretch, I did cramp up and that caused me to have more pain. So just be mindful and use a bit of common sense. If you're not ready for this stretch, just do the easier ones at the start of the video. I found an easy and great way to quickly increase the range of motion with these stretches is warming up your hips with some light exercise or a heat pack for about 5 minutes. This will get the blood flowing into your muscles and your hip joint and reduce the initial amount of stiffness that you need to work through. Heat can be used to reduce chronic pain, especially if you're experiencing a bit of an ache in the joint or you have a bit of degenerative change such as arthritis in the hip joint. Heat will definitely loosen this joint up and also reduce a lot of pain or achiness in that joint and allow you to move a little bit better.
Once again guys, thanks for watching. I really want you to join my VIP Facebook group. I want to build a community there where you can ask questions and I'll try my best to answer them. There'll be other professionals in that group as well that could help you out. And as a whole, we can help each other out. Now, if you found this video helpful, there could be a chance that you're getting a pain in the hip that could be radiating down the leg. That could be sciatica. So check out my best 11 sciatic stretches video. That video will definitely help you out if you do have sciatica or just muscle tightness in the hip. Now, if you do have pain that's coming from the hip, it could be coming from the lower back. So check out my 12 lower back stretch video. That video will definitely help you out if you've got some stiffness in the hip or stiffness in the back that could be compensating each other. And that could give you a lot of pain relief. Remember to support my channel, hit subscribe, hit like, comment below if you have any questions, and I'll see you guys in the next one.